Assalamu alaikum. Dr. Rashid Mahmood here. In this video, we're going to discuss the common neonatal skin conditions that we see in neonatal period or early infancy. Our first condition is neonatal acne. This is usually seen in infants, also seen in 2 months of age of infant, and neonatal period is also seen, in which we get vesicular lesions on the mainly on the face areas, and these are in response to the maternal hormones, and these usually persist for a period of up to weeks, but most of the time we do not need medication for it and it resolves spontaneously. Again, a picture of neonatal acne is shown with lesions on the face. Again, a zoom view of neonatal acne is shown here. Again, a picture of neonatal acne is shown here. Again, another picture with the neonatal acne on the face is seen. So in all these conditions, usually conservative measures are taken. However, in some condition, we can have to go for the topical medication in the form of benzoyl peroxide or some topical antibiotic. However, for most of the time, conservative measures are sufficient, and they do not require medications. Next condition is our erythema toxicum neonatorum. So first, I will like to differentiate the two important conditions. These are benign conditions that are erythema toxicum neonatorum and transient neonatal pustular melanosis. So these are differentiating points that have been shown here in tabulated form. So TNP, that is transient neonatal pustular melanosis, is usually present at the birth, while erythema toxicum neonatorum appears 24 to 72 hours of life. So first important differentiating point between these two conditions. So in transient neonatal pustular melanosis, you will get vesical pustules and the macules. The macules are characteristic of transient neonatal pustular melanosis, while in erythema toxicum neonatorum, only papules are seen, and they are seen on the erythematous hollow. Surrounding area is erythematous around these papules. So typical feature for erythema toxicum neonatorum is that papules will be seen, and they are on the bed of an erythematous surface. The lesions of erythema toxicum neonatorum usually do not occur on the palm and sole, while the transient neonatal pustular melanosis can occur anywhere, including on the palms and soles. And erythema toxicum neonatorum lesion do not lead to hyperpigmentation, while hyperpigmentation can be seen in case of transient neonatal pustular melanosis. So it is very important. These two conditions are very important in MCQ point of views and even in talk station. This is a case of erythema toxicum neonatorum. You can see erythematous cheek area and papules are seen on the surface. Again, a picture of erythema toxicum neonatorum with erythematous lesion appreciable. Papules are here not appreciable. Again, a case of erythema toxicum neonatorum with erythematous areas and papules on these erythematous areas. So no, this is condition of transient neonatal pustular melanosis. You can clearly see the pustular lesions, and there is no typical erythematous area as seen in case of erythema toxicum neonatorum. Again, pustules are seen, and there is no erythema around the pustules, and pustules are clearly demarcated. This is transient pustular melanosis. Again, these are only pustules, and it is condition called transient pustular melanosis. Now, this condition is characterized by absence of skin at the birth. It is cutis aplasia congenita, most commonly affect the scalp, and usually require conservative measurement. As with scarring process, it usually gets healed. As you can see, two picture in one picture it is taken at birth, and other is picture is patient on follow-up where the lesion is healed up and covered. These are bluish black spots seen on the back, and these are typical of Mongolian spot. We have to differentiate them from the any bleeding disorders or any child abuse. So these are Mongolian spots. This is a erythematous lesion which is seen on the nasion area, and it is nevus simplex or stroke bite. So it is a benign lesion. Now this is a lesion which is seen in the distribution of trigeminal nerve, and it is reddish to bluish area, and it is non-elevated, and diffuse redness is seen in all the side of face, and it involving only one side of face. It is typical of port wine stain, that is nevus flammus. Now these are purpuric lesions seen on the different areas of body involving the both arms and both legs. It is typical case of neonatal purpura fulminans. Again, a case of purpura fulminans with gangrene and purpuric lesions are seen on the legs. Both feet are gangrenous here. Again, a case of neonatal purpura fulminans with bilateral gangrenous changes seen on both legs and also on the right arm. Now, this is a case of fat necrosis. You can see here that erythematous and elevated patches are seen on the back of the child. This can be due to birth asphyxia as well as due to hypothermia, and these are also seen on the left arm. Again, a case of subcutaneous fat necrosis with a patch seen on the back of the child. Now this child is having half color of normal color and half side is red and half side is white. So it is called as Hurligan color change. It is due to vasomotor instability and it is benign condition. It usually gets resolved as warming the child. So again, this condition is showing some reticular net-like pattern of child. This can be of two types. One is benign, that is cutis marmorata. Transit condition can occur in case of hypothermia and relieves when patient is rewarmed. Other is cutis marmorata telangiectasia, that is persistent condition and that is due to vascular malformation. These are grouped lesions seen in scalp of child. These are different from the transient erythematous erythema neonatorum and also from the transient pustular melanosis. These are the lesion of herpes simplex virus. Again, grouped lesions of herpes simplex are seen here. Again, in this picture, the different lesions of herpes are shown involving the eyes and also the scalp. This is a very serious condition. Again, a picture of cutaneous herpes is seen here. Grouped vesicle is typical characteristic of herpes lesion. Now, this infant is having a lesion of blueberry muffin rash that is seen in torch infection. These are extramedullary hematopoiesis. These are black lesions seen. This is case of umbilical cord hematoma, which occurs in case of trauma to umbilicus cord. This is case of umbilical cord staining with the meconium that occurs in meconium passage. And this is case of umbilical omphalitis, which is the infection in umbilicus cord. So I have discussed some common conditions that occur in neonate. Thank you so much for the listening of video.